Hey, do you ever wake up in the morning and your hands and feet feel like ice, or you stand up too fast and the room starts spinning just a little? Maybe you've walked across the parking lot and your heart's already pounding like you ran a marathon. If any of that sounds familiar, I need you to stop right now and pay attention, because your body is trying to tell you something important. I'm Dr. Claire Weston, and I've been practicing medicine for over 20 years. In that time, I've seen hundreds of men, strong, hardworking men, ignore those exact symptoms and chalk it up to just getting older. And some of them paid a serious price for it. Here's the truth. Those symptoms, cold hands, dizziness when you stand, getting winded too easy, bruises that won't go away, sleep that never feels deep enough, that's not just aging, that's your circulation sending up a flare. That's your blood vessels telling you they're getting sluggish, stiff, and clogged up. Slowly, quietly, over years. And by the time most guys actually notice something's wrong, the damage is already done. I've had patients come in after a minor stroke, or after we've had to put a stent in because an artery was nearly shut, and almost every single one of them says the same thing. Doc, I wish I'd caught this earlier. Once your arteries harden up or get seriously blocked, you can't just reverse that. You can manage it with medication, sure, but you can't give those vessels their elasticity back, not fully. But here's the good news, and I genuinely mean this. Most of that damage is preventable. Sometimes all it takes is one small, consistent habit. And today, I want to share something with you that most people completely overlook. It's not a prescription. It's not a supplement you have to order online. It's something sitting in most people's kitchen right now. It's ginger. I know what you're thinking. Ginger? That stuff your mom put in cookies? Hear me out. A few years back, I had a patient. I'll call him Robert. Robert was in his late 60s, a retired contractor from rural Tennessee, built like a brick wall his whole life, never sick a day in his 40s. But when he came in at 68, he had high blood pressure, high cholesterol, perpetually cold hands even in summer, and that general feeling of heaviness that a lot of older guys describe. Like the engine's running, but it's not firing on all cylinders. What was interesting about Robert wasn't his diagnosis. It was something he mentioned almost offhand during our third visit. He said his grandfather, a farmer who lived to 94, no heart disease, sharp as a tack, ate a few pieces of raw or lightly steamed ginger every single morning, had done it his whole life. Robert had started doing it himself about 6 months before he came to see me, just out of curiosity. I didn't think much of it at the time, but after that appointment, I went back to my office and started pulling research. And what I found genuinely surprised me. A 2019 study published in the Journal of Cardiovascular Pharmacology found that gingerol, one of ginger's primary active compounds, inhibits platelet aggregation similarly to aspirin, but with significantly less gastrointestinal irritation. For men on low-dose aspirin for heart health, that's a meaningful distinction. It's not a replacement for aspirin if your doctor has prescribed it. Let me be clear about that. But as a complementary tool, it's powerful. A 2021 study in phytotherapy research showed that people who consistently consumed ginger over 3 months had measurable reductions in LDL, that's your bad cholesterol, and triglycerides, alongside modest increases in HDL, the good stuff. That combination matters enormously for keeping your arteries clear and your blood flowing the way it should. And research out of a major university in Asia found that adding even a small daily amount of ginger improves circulation, particularly in older adults who suffer from cold extremities. You know that feeling where your feet are freezing and no amount of thick socks seems to help? That's poor peripheral circulation. Ginger addresses that at the source. Now, I want to talk about the science for a second, because I think it's important for you to understand why this works. Not just that it works. Inside ginger, there are several bioactive compounds. The two most important for cardiovascular health are gingerols and shogaols. Think of them as the blood vessel security detail. As we age, especially in men over 50, the inner walls of your arteries take a beating from high blood sugar, chronic inflammation, oxidative stress. These are microscopic injuries, kind of like scratches on the inside of a pipe. Over time, cholesterol and debris build up in those scratches, blood flow weakens, and you end up with atherosclerosis, blood clots, the whole cascade. Gingerol calms the inflammatory response in those vessel walls, It helps the endothelial cells, the cells lining your arteries, repair themselves. It reduces platelet stickiness, which means blood clots are less likely to form. A 2018 study found that gingerol can reduce platelet aggregation activity by up to 30%, which significantly lowers the risk of clots reaching your brain or heart. On top of that, ginger makes your blood vessels more flexible. When your body gets cold or you're under stress, vessels constrict. That's why blood pressure spikes in winter, why men with cold sensitivity also tend toward hypertension. Ginger's active compounds gently dilate those peripheral vessels. Blood reaches your fingers and toes. Your brain gets sufficient oxygen, and your heart doesn't have to work overtime pumping against resistance. That's what people mean when they say ginger wakes up the blood. It's not poetic, it's physiology. Now I want to address something directly because I get this question a lot. Dr. Weston, can ginger dissolve a blood clot? No, I'll be straight with you. Ginger cannot dissolve an existing clot. If you've already got a significant blockage, that needs medical intervention, medication, possibly a procedure. What ginger does is prevention. It reduces the conditions that allow clots to form in the first place. Think of it like regularly changing the oil in your truck. You're not fixing a blown engine, you're making sure the engine never blows. 3 months after I started talking to Robert about this, after he committed to eating 3 small pieces of lightly steamed ginger every morning after breakfast, he came back in for labs. His LDL was down noticeably. His blood pressure had stabilized. And the thing that stuck with me, he came in wearing short sleeves in October, shook my hand and said, "Doc, my hands aren't cold anymore. First time in years." That's not a miracle. That's circulation doing what it's supposed to do. After seeing that, I started recommending ginger to several other patients with similar profiles. Men over 55 dealing with borderline high cholesterol, cold extremities, mild hypertension, poor sleep. The results were consistent enough that I've made it a standard part of my conversations with men in that category. So let me tell you exactly how to do this, right? Because I've also seen people start this enthusiastically and quit after 2 weeks because they were doing it wrong. First, choosing the right ginger. Not all ginger is the same. For cardiovascular benefit, you want mature ginger, sometimes called old ginger. At the grocery store, look for pieces with thick, rough skin, a deep tan color, and a strong, pungent smell. If it's pale and barely smells like anything, that's young ginger. Fine for cooking, but the concentration of gingerol and shogaol is much lower. I also recommend buying organic domestic ginger when you can find it. A lot of imported ginger is treated with fungicides and preservatives that your liver and blood vessels really don't need. Most Whole Foods locations and farmers markets carry domestic organic ginger, and honestly, it's not that much more expensive. Second, preparation. Here's where most people get it wrong. Don't peel it. I mean it. The skin of ginger contains aromatic compounds and bioactive substances that help regulate blood flow and protect the liver. Peeling it throws away some of the most valuable material. What you do instead, use a firm vegetable brush and scrub the skin under cold running water to get the dirt off. Then dry it completely. Leftover moisture will weaken the flavor when steaming and encourage mold during storage. Third, steaming. This is the most important step and the one most people skip. Raw ginger is harsh on the stomach, especially if you've got any sensitivity there. But if you cook it too long, boil it for 20 minutes, say, you drive off the volatile compounds and you're left with flavor but not much medicine. The sweet spot is steaming at around 200 to 210 degrees Fahrenheit for 12 to 15 minutes. At that temperature and time, gingerol begins converting to shogaol, which has even stronger anti-inflammatory and circulation-promoting effects. That conversion is what I mean when I say the ginger activates. After steaming, let it cool for 10 minutes, then slice it thin, about 1/8 of an inch. At that point, it's soft, deeply fragrant, and easy to eat without irritating your stomach. Fourth, when and how much. Eat 3 slices of steamed ginger about 15 to 20 minutes after breakfast. Not on an empty stomach. Ginger on an empty stomach can cause heartburn or nausea in some people, especially if you've got any history of acid reflux. After food, your stomach is buffered and the ginger absorbs cleanly. 3 slices is the sweet spot. More is not better when if you go above 4 or 5 slices a day, you can start getting excess heat, dry mouth, or disrupted sleep. If you'd rather drink it, that works too. Heat water to about 175 to 185 degrees Fahrenheit. That's just below boiling, the same temperature most people use for green tea. Steep 3 thin slices for 8 to 10 minutes. If you want, add a teaspoon of raw honey. Don't use refined sugar. Honey has its own antioxidant properties and complements ginger's vasodilatory effects. Some of my patients add a squeeze of lemon. Vitamin C in lemon protects the arterial wall lining, so that combination is genuinely synergistic. Fifth, storage. If you want to prep a week's worth at once, you've got 2 good options. You can dry the steamed slices, lay them out in a single layer somewhere with good airflow, out of direct sunlight. Strong direct sun degrades the volatile compounds. After a day or 2, they'll be dry but still slightly chewy. Store them in a sealed glass jar. They keep for 2 to 3 weeks this way. Or you can make an old-fashioned American-style honey ginger vinegar pickle. Take your steamed sliced ginger and combine it with equal parts raw apple cider vinegar and raw honey in a glass jar. Let it sit in a cool, dark place for about 10 days. The vinegar helps thin the blood and reduce fat absorption. The honey protects the stomach lining, and together they amplify ginger's circulatory effects substantially. 3 pieces of this in the morning, or dissolved in warm water, and you're covering multiple bases at once. Now, and this is important, I want to talk about who needs to be careful here. If you're taking blood thinners, warfarin, Xarelto, Eliquis, or even just daily aspirin on a doctor's prescription, talk to your doctor before adding regular ginger. Ginger has mild anticoagulant properties, and combining it with prescription blood thinners can increase bleeding risk. We're not talking about dramatic danger from 3 slices, but it's a real interaction, and your doctor needs to know about it. Men with active stomach ulcers, GERD, or esophagitis should go slow. Start with 1 slice after meal and see how your body responds before going to 3. If you've had a recent cardiac procedure, stent placement, bypass, anything like that, loop in your cardiologist before making changes to your routine. Not because ginger is dangerous, but because your recovery protocol is already carefully calibrated and your doctor should be in the loop. For everyone else, healthy men over 50 with typical cardiovascular risk factors, or men with cold hands and feet, borderline cholesterol, mild blood pressure issues, poor sleep, low energy, ginger is a safe, well-researched, genuinely useful addition to your morning. I also want to address the powder versus fresh ginger question, because I see this in comments a lot. Ginger powder is not the same thing. The drying process used to make commercial ginger powder destroys much of the gingerol content. You can use it for cooking, but for cardiovascular benefit, you want fresh, mature ginger that you're preparing at home. If fresh isn't available, look for standardized ginger extract capsules with at least 5% gingerol content. That's the pharmaceutical grade form. But honestly, fresh steamed ginger costs maybe 50 cents a day and is more effective. Here's what I want you to take away from all of this. For most of your life, you've probably been told that staying healthy means expensive interventions, medications with side effects, procedures, specialists. And sometimes, yes, you need those things, but the foundation of cardiovascular health is built day by day, meal by meal, habit by habit. Ginger won't undo 30 years of cheeseburgers overnight, but it does something that's genuinely hard to achieve with prescription drugs alone. It works upstream. It reduces the chronic low-grade inflammation that silently damages vessel walls. It keeps blood viscosity in a healthy range. It improves the flexibility of arterial tissue. It warms the periphery so your heart doesn't strain to push blood to your extremities. Over months, that adds up. I've been doing this work for over 20 years, and the patients who age the best aren't the ones who get the most aggressive interventions. They're the ones who build small, consistent habits and stick with them. An early morning walk, getting to bed before midnight, drinking enough water, and 3 pieces of steamed ginger after breakfast. I want to say one more thing because I think it matters. A lot of men watching this are doing so because someone they love is worried about them. A wife, a daughter, a son who keeps sending health articles. Or maybe you're watching because quietly, privately, You've been a little worried yourself. You've noticed the cold hands. You've noticed the heart rate that kicks up when it shouldn't. You've noticed the fatigue. That noticing is important. That's your body talking to you. Most men I know are pretty good at ignoring that voice, but I'm asking you not to. Not this time. This one habit, 3 slices of ginger in the morning, consistently for 90 days, is one of the lowest effort, highest return things I can point you toward. You're not overhauling your diet. You're not signing up for a gym you won't go to. You're just adding 3 small pieces of root to your morning routine, 365 days a year. 3 months from now, I'd be willing to bet you'll notice your hands are warmer. Your sleep might be deeper. The afternoon heaviness might start to lift. Nothing dramatic. Nothing overnight. Just a quiet, steady improvement. The kind that actually lasts. That's the medicine I believe in. Not the kind that just manages symptoms after damage is done, but the kind that keeps damage from happening in the first place. If this video helped you, leave a comment and let me know, especially if you've already been using ginger and you've noticed a difference. Tell everyone what's been working for you. Are you steaming it, making tea, trying the vinegar honey pickle? Those real-world experiences are valuable, and the guys watching this learn a lot from hearing what actually works for someone like them. I'm Dr. Claire Weston. I'll be back soon with something I think you're going to find just as useful. The everyday lifestyle habits that American men with the healthiest hearts in their 70s and 80s actually practice. The stuff that doesn't make the headlines but makes all the difference. Take care of your heart. It's been working hard for you for a long time. The least we can do is return the favor.